Good morning. I would like to thank Bangladesh Society for the Study of Pain, specifically Dr. Akhtaruজ্জামান, for inviting me to this meeting. It's always a great honor to be here. I would like to talk about our global online pain fellowship program, which we started in its first year in collaboration with BSSP. Here you see the global map and part of my trip from Minneapolis to Dhaka. Before talking about this global pain fellowship program, I would briefly talk about how we got here. Two things we all appreciate: that sometimes things happen without plan, sometimes happen with plan. For example, how many of you wanted to be a pain physician when you were in medical school? Can you raise your hand? Very good. So this is planned. You wanted to be a pain physician and you got there. But sometimes things happen without plan. Like me, I didn't plan to be a pain physician. In fact, when I was studying in Sir Salimullah Medical College in early 1990s, I didn't know that a pain specialty exists. But at that time, when I was in medical school, my father, who lived in a rural village of Bangladesh, went to the doctor to get a intramuscular clofenac shot for back pain. And he was a very thin guy. Whoever injected that clofenac shot did a poor job. Injection went indirectly to his sciatic nerve. Injection went directly to his sciatic nerve, and he developed complex regional pain syndrome. He suffered with extreme pain in the rest of his life, almost 30 years. So many years later, when I was doing anesthesia residency in the Albert Einstein Medical College in New York, I didn't need to think twice what specialty I would choose. What subspecialty I will choose. I know that it's pain, because pain has such a deep impact on my father. I watched him, how he suffered. So I did a pain fellowship at MD Anderson Cancer Center in Houston. Then after the fellowship, I joined University of Minnesota as a faculty. I never thought about writing a book. Life was extremely busy. I have pain clinic, I have operating room, nerve block, and then basic science lab. It's just too many things going on. Several years later, we had COVID-19 pandemic. As you know that it was the darkest time of our entire life. So my clinic, research lab, everything closed. Hospital operating in a very limited capacity. All elective cases are cancelled. Basically, I'm working only 1 or 2 days of the week. Usually we work like 5 a.m. to the evening, 6 to 7 days a week. But with COVID-19, most of the time staying home, although still getting paycheck, which is good. I thought I will be very happy. The first week, very excited. Second week, excitement a little bit went down, but still excited. But over time, then I found out that it is extremely boring to pass time at home. So I started thinking, how to make this time, how to spend this time in a more productive way. How to utilize this time an opportunity for creativity. So I have long experience in scientific writing. I did my PhD, I did postdoctoral fellowship, I wrote tons of scientific papers. So based on this experience, I decided to submit a book proposal on regional anesthesia and pain medicine to two world leaders of the publishing, medical publishing, Elsevier and Springer. And my applications approved very quickly. And I decided to go with the Springer, who responded at first. Then the book was published in 2022. And one of the characteristics of this book, those of you who read this book, is each chapter is short, like keywords, explanation, bulleted text for easy reading, and clinical pulse in each of the chapter on high-yield concept. And there is MCQ, couple of MCQs in each of the chapter. Anyway, after a few months of the publication of this book, I got an invitation from Dr. Akhtaruজ্জামান, BSSP, and who invited me to attend the 9th SHARPS meeting. It was a great meeting, by the way, probably one of the best meetings I attended in South Asia. I visited many countries, and I can tell you this was one of the best meetings. When I was thinking about a topic of the presentation, I was not completely sure actually what to talk about, because I am a basic scientist. I talk about basic science, clinical research. I talk about spinal cord stimulation, which I do very routinely. So I was not sure that these topics will be appropriate in the Bangladesh context. So, but at the time I was recall that my friend Satyajit Dhar, who is probably in the audience. Dr. Dhar, are you there? Okay. So he was going to different countries, India, Bangkok, different countries, going for a pain course. And I had conversation with him on the Facebook. He said, there's no pain fellowship in Bangladesh, so we take short courses in different countries. I thought that we can probably do this type of course in Bangladesh. World is getting smaller. We can teach them via Zoom, and I go once a year. I can do some workshop. Then our doctors can save money. So that was my topic of presentation topic and SHARPS meeting. After the meeting, we were able to develop this fellowship program. So we built a very robust curriculum for this course. There are 74 topics on regional anesthesia and pain medicine, all of them curated from the American Board of Anesthesiology content outline. We developed 6 modules for regional anesthesia for nearly 40 concepts, and all of them from the ABA content outline. You can scan this QR code to get complete list of these topics. And this was a 12-month program. Each session we had 1 hour long lecture, 30-minute quiz, and 30 to 45 minutes of quiz discussion. In total, 2 to 3 hours. For pain medicine, you also have a similar 6 modules for nearly 40 concepts and AVA content outline. Again, you scan this code, you get the complete list of these topics. In 2023 and 2024, we had almost 124 enrollees. Here you see that distribution of the attendance in each class, plus number of the participants who completed the quiz. And not everyone completed quiz, but majority did. As you see here, we use Qualtrics software program, which keeps a real-time score. One interesting thing you see from this slide is that there is a steady decline in attendance after the first session, up to the sixth session, and then decline kind of stabilized. So rest of the courses, we have approximately 35 to 45 participants in each class. There are maybe few factors who contributed to this decline. A lot of participants are anesthesiologists who don't practice pain medicine, and they do a lot of nerve blocks. So once the regional anesthesia section is over, they quit. Another possibility that people at first came with a lot of enthusiasm to this course, and they found out that it is hard, and timing is also a little bit odd because it's 9 p.m. to midnight Bangladesh time. And maybe study materials are hard, I don't know. Dr. Akhrujaman knows most of these people, so he might comment on that. An average score of each applicant is shown in this graph. I divided score into two groups. One group, all participants, versus people who graduating from this class. As you see here, the average score of the graduates are higher in almost all sessions. They performed really well, worked hard, and stayed in this program. Those who did not perform well left the program without completion. This may be another reason of quitting. Because we mentioned in the beginning that each participant must get more than 70% score and more than 80% attendance in all classes. So next question you might ask, is this course follows international standard? And the questions are too easy, too hard? Are there lack of quality issues? So we answer these questions. To answer these questions, we, in one class, Pain Medicine 101, we invited US anesthesia residents and pain fellows to join our class. So they attended lecture, did quiz, exactly the same way our Bangladeshi anesthesiologists did. And here's the comparison. As you see there in this comparison, overall there is no difference in the average score of these three groups. US resident fellow did slightly better than all participants, but it was not statistically significant. On the other hand, graduates of this program did slightly better than US resident fellows. Again, the difference was within the margin of error, and it was not statistically significant. So we can conclude from this graph that program maintained same standard as US medical education. Finally, here is the list of the graduates. I congratulate them from bottom of my heart for their hard work, their tenacity, their integrity, and desire to learn. I would like you to note that 6 physicians were highlighted in this slide, got highest distinction, honors, for scoring more than 75% on average of all sessions. Please give them a big applause. Finally, I have a few words for the graduates. Your journey to pain medicine just started. Never stop learning. It's a huge and terribly interesting field. Make effort to learn. If you stop learning, that means you stop growing. As I mentioned in the class, don't consider this certificate you received today is a license to make money. Money will definitely come to your way, but do your best effort to make honest practice. Don't offer a procedure unless it is absolutely needed. Don't offer a procedure unless you think it will help patient. Don't offer a procedure unless you think that you will offer the same procedure to your mom and dad, your best friend, your relatives. Whenever someone come to you, make your best effort to give them right information, and please do not persuade them for intervention just to make money. That's all I would like to say.